Brucellosis is a highly contagious zoonotic disease caused by the Brucella bacteria, which primarily affects cattle, including dairy cattle. This disease is not only a significant concern for animal health, but also poses a risk to public health due to its ability to be transmitted from animals to humans. The causative agent of brucellosis in dairy cattle is Brucella abortus, although other species like Brucella melitensis can also affect different animals. The impact of brucellosis on the livestock sector can be severe, leading to economic losses and ongoing challenges for farmers. The transmission of brucellosis primarily occurs through direct contact with infected animals or their bodily fluids, such as during birthing or abortion. Infected cattle can shed brucella in their milk, urine, feces, and placenta. Humans can also contract the disease through consumption of unpasteurized milk or undercooked meat from infected animals. Additionally, the bacteria can spread through the air in high-density livestock areas or through contaminated feed and water. The main risk to dairy farmers, veterinary surgeons, and other people working closely with cattle is through handling infected animals and their products. In dairy cattle, brucellosis manifests in several noticeable symptoms. The most prominent and concerning is abortion, which typically occurs in the later stages of pregnancy, leading to significant losses in herd productivity. Infected cows may also experience infertility, leading to difficulty in getting pregnant again after an abortion. Milk production can decrease as a result of reproductive issues, and some cows may develop arthritis or lameness. Additionally, retained placenta and vaginal discharge are common in chronic cases. These symptoms contribute to the overall economic burden of the disease, particularly for dairy farmers who rely heavily on their livestock for milk production. Diagnosing brucellosis involves serological tests, such as the Rose-Bengal test, buffered Brucella antigen test, and brucellosis ring test, which help identify infected animals. PCR tests and blood cultures may also be used to confirm the presence of Brucella bacteria in the animal system. Unfortunately, there is no cure for brucellosis in cattle once an animal is infected. Antibiotics like tetracyclines may help in the early stages, but treatment is generally ineffective in preventing the disease from spreading or completely eliminating it. Infected animals, particularly those with recurrent abortions or chronic symptoms, are often culled to prevent further transmission. Preventing and controlling brucellosis in dairy cattle relies on a combination of strategies. One of the most important measures is vaccination. The HERB51 vaccine is commonly used in young heifers to reduce the risk of infection and to minimize the occurrence of abortions. However, vaccination does not provide full immunity, and some vaccinated cows may still become infected or shed bacteria. Regular screening of herds is essential to detect infected animals early, and culling remains a key component of disease control. Additionally, implementing strict biosecurity practices, such as improving farm hygiene, restricting animal movement, and ensuring proper quarantine protocols, can help reduce the risk of infection. Brucellosis is a zoonotic disease, meaning it can be transmitted to humans. For people working in close contact with infected cattle or their products, there is a risk of developing undulant fever, a condition characterized by fever, joint pain, fatigue, and headache. Dairy farmers, veterinarians, and slaughterhouse workers are most at risk. To reduce the human health threat, it is critical to consume only pasteurized milk and properly cooked meat from cattle. Public health awareness and education campaigns play an important role in preventing the spread of brucellosis to people and encouraging proper hygiene and safe food practices. The impact of brucellosis on the dairy industry is far-reaching. Beyond the direct financial losses from culling and reduced milk production, Brucellosis can lead to trade restrictions, preventing infected regions from exporting dairy products. The disease also affects public confidence in the safety of dairy products, further exacerbating the economic losses. Brucellosis eradication programs implemented in various countries aim to reduce the prevalence of the disease through widespread vaccination, testing, and surveillance. While progress has been made in some regions, ongoing challenges remain, particularly in countries with limited resources. Brucellosis control requires a comprehensive approach that includes vaccination, regular testing, culling, and biosecurity measures. Raising awareness among dairy farmers about the risks of brucellosis, the importance of vaccination, and the value of consuming pasteurized dairy products is essential to reducing the impact of this disease. Ultimately, a coordinated effort between veterinary surgeons, public health authorities, and dairy farmers is key to minimizing the risk of brucellosis and ensuring the health and productivity of dairy cattle, as well as safeguarding human health.